Hi, I'm Dr. Arent. At Kaiser, we take pride in our care of our patients, and that's reflected in some of the bundles that we've undertaken. Specifically, the AMI bundle, which since starting in 2005 and looking at the most recent data in 2011, we've had 53% fewer deaths. More importantly, our septic shock bundle, since starting that in 2009, in 2011 we had 56% fewer deaths. That made us look at probably the #1 cause of problems here in the hospital, and that's hospital-acquired pneumonias. The reason we're taking such a close look at hospital-acquired pneumonias is that it's the #1 most common harm we identified at the hospital, and it's the #1 harm believed to have contributed to patient's death. Dirty mouth is that we aspirate. Now, normally people aspirate on a routine basis. Everyone does it at nighttime. But when you're young or old, but you're healthy and you have an intact immune system, typically you can deal with the problems. However, when you're in a hospital, that's an entirely different situation. There are a lot of different factors which play into this, which impede our own ability to overcome these microaspirations. To start with, we'll start with the head. When you think about it, you have to have proper positioning in order to be able to swallow. When someone's lying down, gravity, which normally keeps your stomach contents in place, is gone. So now gravity is working against you, and it brings fluid back towards your lungs. The mouth, however, is not as clean as the lungs, and it has anywhere between 10 to 100 million pathogens per square milliliter. Now what that means is that if we're aspirating those, we're getting bugs into our lungs. Now it's not such an abnormal thing to aspirate. Everybody aspirates. Typically we call these microaspirations. The problem we come into is when we have other factors playing into our healthcare that prohibits our body from protecting us from these microaspirations. So, in order to reduce the incidence of hospital-acquired pneumonias, there are several things we need to do. Specifically, decrease the delivery of serious pathogens to the lower respiratory tract, and we need to improve the lungs' ability to clear them. And again, that's through the HAP Bundle. The stomach is typically a relatively sterile place, mainly because of the pH. When patients complain of heartburn, you see it on television, they all take their Pepsid, they take the Prilosec, their Mylanta, and their Tums. And what this does, it actually alters the pH of the gastric juices. And when that happens, we actually have bacteria that are able to grow in the GI tract. If someone has a bowel obstruction, if someone has been constipated and their bowels aren't moving forward, if someone has been laying down all the time, these things all can cause gastric contents to come back up, and because the lungs are just an offshoot of the esophagus, all of those contents can get into the lungs. That's why I really push that patients get up and ambulate. That's why I make sure that my patients have their bowel movements. That's why we try to get rid of Pepsid and omeprazole and Prilosec if we don't need them. It's really to protect the patient. I've been able to take care of many patients throughout my career, and I've had several experiences where I've lost patients due to infections that could have been prevented. One particular patient came in for a routine hip operation, and after a couple days of getting a little bit better, she took a downturn. Unfortunately, she was transferred to the unit, and within 2 days, she was placed on comfort care. This is just one of the many stories that people face every day when working in the hospital. And what we're trying to do is to everybody pumped up to actually get patients out of the hospital. And we're going to do that by following this HAP Bundle. The HAP Bundle are things that you do on a daily basis. It's just documenting them. By documenting them, we ensure that we actually do them, that we get our patients up, we get our patients moving, we make sure that they're eating well and they're drinking well, they're sitting up. All those things that you know that you would want your mom, dad, sister, or brother, or loved one to be doing in the hospital.